to be back in the office starting out 2023 with one of my all-time favorite speakers. As you know, I got nothing but lots of love for my go-to man, Dr. Mario Fucinari. Y'all know how much I love him because I talk about it every time I ask him to speak on a webinar. He is truly the go-to expert. Heather and I talk about it like we feel kind of bad sometimes. We have regular communications because something will come up, somebody will ask a question, and we know that Dr. Mario has the answer. And in fact, I mean, Mario, we've been like texting like for the last week with all of the updates that are coming out and you preparing for this, y'all. He was working on his slides all the way till last night because there is so much stuff that's coming out for 2023. And he was like, this is the best that I can do because we're doing this tomorrow. So we are super stoked that you guys decided to spend this Tuesday with us today to learn from the man, Dr. Mario Fucinari. Thank you so much, Dr. Fucinari.
Well, thank you, Christy. All right. Well, there's a lot of people here, and we're going to get started here. Before I get started, I'm just going to tell you, this is a 1-hour class, and it could be easily a 6-hour class, okay? But I will tell you, I always have my pad of paper whenever I am taking notes here. And although this class will be archived, it's for your betterment. And so grab a pen, grab some paper here. Yes, this is a class, so you should write down whatever you can, okay? So we're going to get started here, and I will hopefully take questions. But again, if you're saying, are there notes for the class? There is a link that Christy will provide with some NSA No Surprises Act forms here, but because the class is archived, you can watch it over and over and over again if you really want to, okay? So we're going to get started here, and first thing, if you have not taken, there's a lot of people on this class here today, but if you haven't taken classes with me before, first of all, I'm a chiropractor, and I was in practice. I have to get used to that now. Up until a couple of years ago, and I retired to Plan B. I'm not retired now. Every day's a Monday. I work 7 days a week, but I'm a certified professional compliance officer, certified physician practice manager, insurance consultant, and a whole bunch of other stuff. I teach all over. ChiroHealthUSA is so I'm so fortunate that they sponsor me, as well as Foot Lovers and NCMIC. I am on the Medicare Advisory Committee, and so therefore I bring that information to you. Now, let's start to get into the class here, and I just got to tell you, information is still changing, okay? For the first time in 100 and whatever years, which I wasn't there, but in 1856 was the last time Congress took so long to elect a speaker for the House of Representatives. So as you know, Congress was kind of on hold until yesterday. And so now everybody is scrambling to get all the updates here because Congress has taken forever. So you are getting information real time as I know it right now. And I keep checking, and I will tell you, most likely some of this stuff, and I'll tell you where, may even change tomorrow or the day after. And it's not like, it's like one slide, okay? But the key is, if you go to Facebook.com, this is not a sell job, it's just Facebook.com/AskMario. Make sure you do the /AskMario and then like me and put me in your notifications. I don't post stupid stuff, okay? It's not like, what kind of bread do you like, okay? Who cares? Okay, this is stuff you can use in your office and assign somebody. If you say I'm not on Facebook, then get somebody, okay, on Facebook. But Facebook.com/AskMario, like me, put me in your notifications, and then again, I don't get your email or anything like that. I can't spam you or anything else here. This is for your information, okay? All right. So as Christy said, Happy New Year. All right, you made it. Okay, we made it through another year here. Thank God here. And, the key is, I understand how it is to be in practice. I still, on a regular basis, am consulting with practices, and I actually work for a company that I do compliance, and we've got 77 providers under my umbrella, okay, that I take care of. And so the key is that I understand when you tell me, there's a copay, or they're cutting down reimbursement, or, there's only so many visits and everything. And the bottom line is, yes, you got to work smarter, not harder. Okay. And my job, part of it is keeping you up to date, and so that you can practice the way you want to practice, number one, but also practice in a very efficient manner, okay? And I like starting off with this quote here because it's very true, and that is that running a successful chiropractic office requires a clear understanding of coverage standards of Medicare or other private payers and how to bill for those services. Chiropractic offices and consultants, me, should stay up to date with the billing and coding changes. Now, some of you out there saying, well, I have a cash practice. Yeah, all right. Consider that a cash practice nowadays is considered to be a high-risk practice for lawsuits, okay? Cash patients are apt to sue a chiropractor, okay? But otherwise, if you look at the standards of Medicare, most insurances either follow Medicare guidelines or Blue Cross guidelines, okay? Now, as I go around, and I will be teaching, and I'm most likely coming to, a city near you. Right now I'm teaching 20 weekends this year, okay? And it's not the booking's not over, okay? But the key is that if you're a cash practice, when was the last time you read your state's chiropractic board of examiners and looked to see what is required in your state for documentation? Okay. I will tell you, I look up every state, and when I teach in that state, I teach those documentation guidelines as well. Okay. So the key is, just because you're cash doesn't mean you're off the hook for, ethical and medical necessary services and documentation as well. Okay. So the key is that as you go through, you want to build a bulletproof vest. Okay. And you know what? It's not even a vest, it's armor. All right. Protect everything in your life. Okay. So there are certain manuals you have to have. Okay. Number one, you must, and all of you, I don't care if you're cash, PI, Medicare, a combination, hybrid, you have to have a corporate compliance manual and a HIPAA manual. Okay. And those are two separate manuals there, and it has to be a living document. That's why I have that heart there. Okay. Yes, there are manuals out there. You can, make one yourself if you want to, but time is of essence here. If you want to look at resources available to you, you can go to my website, askmario.com. But the key is staff training is required. Okay. So 1 hour of compliance, 1 hour of HIPAA training per year. Does this count for that training? No, because I'm not spending 1 full hour on HIPAA or 1 full hour on compliance. Okay. But the key is that use the information here to train your staff and, expound upon that here. If you need help, send me an email as well. And my email's at the end of this presentation, which is doc at askmario.com, doc@askmario.com. And, I do Zoom training for offices and help out and answer questions that way. Okay. So number one, get your corporate compliance manual, get your HIPAA manual. Okay. Any information I give you today that you're going to change, put it into that manual there, okay? When you look at the manual, keep in mind that Medicare, Medicaid, and everybody else here, that audits are on the rise. Right now, update, okay, is that Medicaid audits, if you accept Medicaid, okay, in addition to Medicare and everything else, if you accept Medicaid, keep in mind that the audits are on the rise. And I thought I better let you know about this report that came out in September. CMS continues to explore options for improving the timeliness of recovering identified overpayments, okay? And so they hired this company, this financial management group, and that group is now auditing Medicaid. Now, I know you go, oh gosh, can we, get out of Medicaid? There's practitioners out there that maybe 20, 30% of their practice might be Medicaid. There's others that are 20, 30% Medicare. Okay. Keep in mind, you cannot opt out of Medicare. You cannot, as a chiropractor, opt out of Medicare. And don't play games by having every patient sign option 2 of the ABN form. That is illegal, period. Okay. So the key is that in addition, you have Medicare Advantage, which is Part C. Now, what's really different about that, and I can't do a full class here, but keep in mind that Part B, Medicare in chiropractic, only covers spinal manipulation for active care. But a Medicare Advantage program, nowadays, many of those programs, probably about 2/3 of them, they actually pay for an exam. It's a private contract. Many of them pay for maintenance care as well. All right. So I just recently had a doctor tell me that it was a United Healthcare Medicare Advantage program. And after a copay, the patient had 100% coverage for everything, including rehab. Okay. So the key is you got to check on the benefits, because Medicare Advantage is not the same as Medicare Part B. All right. So you got to call, you have to ask them, do you follow the Medicare fee schedule? Do you cover any services other than spinal manipulation? And many of them do now. Okay. Do you honor or accept the AT modifier? Most of them do. Do you honor or accept the ABN form? Most of them do not. The Part C's do not. And therefore, write it down. You want to use the good faith estimate, the GFE notice for those clients there, okay, those patients, all right? What is that? I will teach it to you, okay? All right. So in your compliance program, and just to go through this, these are the 7 steps here of the compliance program. Who's your compliance officer in the office? Okay. Written policies and procedures. I'm going to talk about some of those here. And keep in mind that number 5 there, conducting internal monitoring and auditing. When they ask you for notes, anybody, all right, it's too late to change your notes here. And so you might want to consider about the auditing. Now, there is an 8th element, and I'm going to go through step by step, because this is the most commonly missed, and you don't want to be out there low-hanging fruit, okay? All right. And that is the 8th element, is to look up the doctor and all employees of the office under the OIG exclusion database, okay? When was the last time, if ever, you did it? Did you do it this year? If not, then you need to change that, okay? So I'm going to give you step by step if you want to write it down, okay? All right. Number 1, go to oig.hhs.gov. There's the site right there, okay? When you go to that site, this is what you're going to see, something like this, okay? And you see that red arrow at the top there where it says exclusions, okay? You click on that. And when you click on it, you're going to get a drop-down menu. And then you click on Online Searchable Database. This will take you probably 2 minutes to do, okay? It's not a big deal, all right? Just don't make it easy for some auditor to find you, okay? When you click on that, you're going to get a table, and on the table, you're going to look at multiple entries. You see where it says search for multiple entities up there. Now, in this case here, I was hoping for health insurance and 3 meals a day in federal prison, but it has, I put in my name and my wife's name here. And when I click search, you'll see it comes up, our names there, but it says no results were found for. But you'll notice that at the bottom there, it says search conducted, in this case, November 21st, 2022 at 11:48 a.m. Eastern Standard Time. Okay. Now, what you're going to do then is you're going to take that search right there, and you can research, many names there, up to 6 names at a time. So do all of your staff. If you have more than one office, do everybody at both offices there, and then you print this up and you put it in your compliance manual. How often do you need to do this? Okay. The government says as often as needed, all right? If you're a bigger organization, probably monthly, but for the chiropractic office, I would just say for your typical chiropractic office, do it twice a year. So do it now, do it again in June or July, okay? And you'll be fine, all right? So that was number 1. Okay, now, by the way, if you need manuals, here's a QR code here. That'll take you to the website. You can look at that, and there's there's a promo code if you want to use that as well, okay? All right. Okay, let's move on, and let's talk about HIPAA. HIPAA are one of those things that are changing. As soon as our government, you know how the government is, okay? They sit there and they wait and they think about it, and then finally when it gets signed into law, it goes into effect tomorrow, okay? So here's the 36,000 foot overview of HIPAA, all right? Number 1, you have to have 3 officers. Now, this is in addition to the compliance officer for the compliance manual, okay? This is just pertaining to HIPAA. And so here you're going to have a privacy officer, a security officer, and a complaint officer. Now, all these officers could be the same person, all right? But make it somebody who, is knowledgeable about this and maybe, is trained on it, okay? I don't want to be your compliance officer. I'm a compliance consultant, okay? But, you as an officer, if I have CAs as an example, they'll call me up and say, I'm the compliance officer or the HIPAA privacy officer for this office, and I have a question. And then we talk, okay? So, but that has to be written down, all right? Now, do you have a privacy officer, security officer, and a complaint officer? Could be the doctor, could be staff person, but it should be somebody knowledgeable. And their name has to be written down, okay? Now, all members of your office are to be trained on HIPAA corporate compliance and the Cures Act, which I will teach you about today, okay? And this includes the doctor, staff, volunteers, anybody here. Okay, if you hire somebody new, they should be trained in a reasonable time. Reasonable time is likely 90 days, but I say within 2 weeks. Okay, just basically, training for HIPAA is watch what you say. Don't post stuff on Facebook, and just keep it confidential. All right. So here's some required compliance training documentation. If you did happen to go and get my HIPAA book, it guides you through step by step. Who's the training source? Okay, did you get trained? Date of training, the notes of the training, attendees' names here, and document your policies and procedures pertaining to HIPAA. I'm going to talk about a few of those here today, okay? Now, the privacy rule is a huge, huge document, okay? But when it comes down to it and you boil it down, the general rule is that a covered entity may not use or disclose protected health information except as permitted or required by this subpart of this subpart of this subpart of this subpart, okay? What's a covered entity? Okay, look in the mirror. It's you, okay? It's the doctor's office. So it's, a hospital. It's the doctor's offices, or the doctor themselves here. It could be a clearinghouse, could be also a health plan such as Blue Cross, okay? It says here you cannot use or disclose protected health information except as permitted or required. Well, to use or disclose, now just listen to me for a second. In the old days, if I were to talk to my staff or anybody else about a patient, I would have to get permission. Wait a second, that is not time efficient. It's just not practical, right? And so they put an exception in there, okay? And so to use information is within the office, to disclose it is to send it out, okay? The exception, in other words, you don't have to have patient permission, is when you send out information or use information for treatment, payment, or healthcare operations. We call that TPO, okay? Treatment would be, as an example, if I want to refer a patient to a neurosurgeon and I tell the patient and they go, okay, and now I send a letter to the neurosurgeon, one pager that explains why I'm referring the patient over. Payment, of course, is the information, the demographics on the patient to get your bill paid. Healthcare operations, I deal with that every day. Number one, I'm reviewing notes for doctors. Number two is, a collection agency, things like that. Okay. Now, so to use or disclose information. So when you call up even the patient and you get somebody and say, hello, is Tom there? No, he isn't. Can I take a message? Yes. Can you let him know that he has an appointment at Decatur Back and Neck Center? Okay, my old office. Okay. All right. Well, that's a HIPAA violation if Tom did not give you permission. And so therefore, that's why you have to have an emergency contact information form. And yes, we provide that to you if you get our books there too, but you have to have a form and make sure that's up to date. Why am I telling you this now? Because this is, once a year. Here we are currently at the beginning of the year, but whenever, if you're watching this archive class here, just do it. Okay, update the information. Are you currently at this address? Is this the best phone number to reach you? Okay, contact information in case something happens. If there's a snowstorm, if there's a power outage, if the doctor is sick, if something happens and we need to contact you, can we leave a message with somebody else? Do you text your patients? Okay, well, you have to have permission to text as well. Okay, it's all one form. Keep it simple, right? But make sure it's up to date here. This is the time. Just because they said 2 years ago you can call this person doesn't mean that they still give you permission. So I recommend updating that form once per year. Okay, now here's some changes. This is going to blow your mind here. Okay, when is this going to take effect? I don't know, but it's going to take effect soon. The proposed HIPAA rule would add a new right that generally would enable patients to take notes, videos, photographs, and use other personal resources to view and capture protected health information in the designated record set. What does that mean? Well, when this finally goes into law, and right now it's already gone through the process and the, as far as comment period and everything else, that a patient can say, I'd like to take pictures of my chart. I would like to, you're doing a report of findings. Do you mind if I record this while you're talking to me? Okay. Normally I would say, yes, I mind. You can't do that. Now it says the patient is able to take notes, videos, and photographs. Okay. I know I'm just a messenger. Okay. Relax. All right. But the key is that, I've read a lot of things and they say, give the patient a private area where they could take pictures of their chart in peace. Okay. I disagree. That's just my opinion, because I'm not going to leave a chart with a patient. What do you do in case of electronic records? I don't know. Okay. I'm just telling you, this is coming down the pike. And when it comes down, how are you going to find out about it? Facebook.com/AskMario. Okay. Make sure you get on there. Okay. All right. The next thing, I know I'm just hitting some topics here. This is a bullet, point class here. Okay. The Cures Act. First came HIPAA, then the Cures Act, and then HIPAA again. And it's like going back and forth here. They work together, and keep in mind, this is all about patient accessibility to their own records. In chiropractic, it's kind of difficult, because if you have a medical doctor, as an example, most medical physicians or hospitals have a portal where I can go on there and I can download my x-ray report. Excuse me. I'm sorry. Where I can download my lab report, right? In chiropractic, we don't have this, all right? So therefore, patient accessibility to the records. You don't want to be guilty of information blocking. The Cures Act defines information blocking as any business or technical or policy and procedure that discourages the access, okay? So I don't see you out there, but you're all listening here, and I can see you in the chat room there, okay? If I want to get a copy of my records from your office, what procedure do I have to go through? Okay, so I call up and ring, and hi, this is Christy. May I help you? Hi, Christy, this is Mario. Hi, Mario, how you been doing? I'm good. Do you need to get in? No, I'm actually going to see a neurosurgeon, and I would like to get copies of my records to send over there. Okay. Now, do you have the patient come in and fill out a form? That most likely currently is considered to be information blocking. The reason is because you can identify me over the phone. Okay. Now, how are you going to send that information to the patient? In other words, if you can identify the person on the phone, the patient. Now, this is not a lawyer, okay? This is not even an insurance company, because you don't know who's going to be asking you questions here. But if the patient calls and said, I want to get copies of my records, you have to provide those copies here. The rule, the Cures Act rule, includes a provision requiring that patients can electronically access all of the electronic health information at no cost. So, what information do you store in your computer electronically? Okay. Do you, as an example, have soap notes in there? How about scheduling? Financial records? How about digital x-rays? You see? So anything now that is there, and they expanded the law as of October 6th, 2022, that anything you have electronically, that patient has to get access to it, and in a timely manner, okay? Now, here are some lawsuits here. This, you can see December 15, 2022. This is current. And it says, look at the title first, HHS Civil Rights Office resolves HIPAA right of access investigation with a $20,000 settlement. Okay. Now, I don't know about you, But if I got fined $20,000, I would not be having a good day. And it says here, the rule requires the patient be able to access their health information in a timely manner. The investigation marks the 42nd case to be resolved under the OCR's HIPAA right of access here, okay? If we go down a little further, it says the right of patients to access their health information is one of the cornerstones of HIPAA and one that the Office of Civil Rights takes seriously, okay? So we will continue to ensure that healthcare providers and health plans take this right seriously and follow the law, all right? So the bottom line is, what are your procedures, policies, and procedures in your office pertaining to patient access? You want to be prepared, okay? Most patients are reasonable about that, all right? I'm going to help you step by step here, but the key is have a staff training session, all right? You got to do some training of staff here of how to answer the phone, because they are the ones, and maybe you're on here now, but talk to your doctor if the doctor's not on this call. By the way, if the doctor's not on this call, why not? If the staff's not on this call and the doctor is, why aren't the staff on? You should work as a team, okay? Healthcare organizations, okay, I didn't write this. This is copy and pasted from the law. Healthcare organizations must give patients unfettered access to their full health record in digital format. In other words, if you're doing paper records still, okay, does a patient still get access to it? Think if you were the patient and you say, I have to go to this doctor and I want to get copies of my x-ray report from your office. Wouldn't you want access to it? That's what it's all about. The proposed HIPAA changes shorten the required time frame for responding to the patient request from 30 days to no later than 15 days. Okay, so right now, okay, you basically, if you're going to go 30 days, you better have a real good reason for it, and most likely 15 days. But if it's electronic, you may be asked to send it to them through email, and I'll talk to you about that in a moment. Okay, this strengthens patients' right to inspect their PHI in person and capture images of their PHI. Okay, PHI, remember, is protected health information, reducing the identity verification burden on patients exercising their access rights, which means if you can identify me over the phone, that's good enough. Not you have to come in and sign paperwork now, okay? Creating a new pathway for patients to direct the sharing of protected health information, which means provider to provider. Okay, we don't have the same portals in most instances as their PCP, although I might be their PCP too, right? So the key is that pathway, and it's all for the patient's betterment. It's not about you and I, it's about the patient, all right? So do a risk assessment, all right? Let's do this here. This is our risk assessment too, okay? Number one, avoid restrictions on access, exchange, or use of PHI. How are you going to send me the protected health information, the SOAP notes? Do you email it to me? Email could be hacked. Do you fax it to me? Do you snail mail it? Gosh, who knows how long that'll take nowadays, right? Avoid limiting or restricting access, such as disabling the capability of software to share protected health information. Avoid impeding innovations such as licensing technology, which means if you have EHR software, does it allow patient access, a portal, whatever? Okay, typically it doesn't, but did you check and ask them? Okay, and I don't recommend a call. I recommend everything being done as far as in writing. In other words, send an email to your software company and saying, do you have any plans to develop a patient portal where they can access certain portions of their records. Okay. Some software may have it, some may not even be doing it. Avoid policies requiring requests in writing or seeking rent or charging fees. Avoid action by a vendor, which is a software company, such as not adopting standards or certification criteria. In other words, I have talked, and I'm not going to be mentioning companies here today, but I have talked to like one. They said, we're not going to be even looking at this. In fact, we're not updating our software at all. Okay. Those companies you probably will have to change eventually. Okay. And assess if there are any impediments or lack of technology, and then document why you can't meet that. Okay. All right. Okay. Okay. Is your head buzzing yet? We're not done yet. Okay. All right. So let's talk about the No Surprises Act. Okay. Now, let's just talk here. Okay. If you were a patient and you went to a doctor, or, okay, here's one. Okay. I had a colonoscopy done in the past. Okay. And my doctor and the hospital are in network. Okay. And so I knew that my services would be covered by my insurance. But this anesthesiologist comes in. Now, I remember the anesthesiologist asked me a question, and after that, I woke up and they go, okay, how did it go? You know, and I was done with my colonoscopy. And they told me I had an impacted wisdom tooth. No, I'm just kidding. Okay. But the key is, you want to know ahead of time if you're going to have to pay out of pocket. If your doctor is not in your network, you want to know about it, don't you? Right? It's the same thing for your patients. It's not that hard. Now, you might be thinking to yourself, I'm a cash practice. I don't have to deal with this. Okay, baloney. Yes, you do. In fact, the No Surprises Act heavily affects cash practices. Okay. So the act bans certain out-of-network charges and balance billing without advance notice to the patient. Healthcare providers and facilities must provide consumers with a plain language consumer notice. Don't start getting upset. I'm going to help you with this. All right. This is how, you can read slides, but you can also just listen to me. Okay. Number one, there is a No Surprises Act notice, the NSA notice, all right? The NSA notice should be posted in your reception room. I recently saw an office and they just had a QR code that said, scan this and it'll take you to our notice. You might be thinking it's a good idea, but what if the patient is not technology savvy? What if they still have a flip phone and they can't scan that QR code? Is it really worth a $10,000 fine? No. Okay. I gave you the notice. It's in the link that's going to be provided to you here. And all you do is you download it, print it up, put it into a 8.5 by 11 frame, hang it on the wall, and you never have to worry about it again. It should also be on your website, at least a link easily searchable from a public engine, search engine, which is on your website. Okay. And orally, when a patient schedules, your staff should know. I asked one office recently, I go, is your doctor a participating provider or non-par doctor with Medicare? She had no clue. Come on. She answers the phone. You got to tell your staff. All right. Okay, so have it like prominent areas in your office, check in, a payment area. It might be more than one. Okay, next to the privacy notice, because your HIPAA privacy notice must be on your website. Your HIPAA privacy notice must also be prominently displayed, I'm quoting here, in your reception room. Okay. And it should be on your website and reception room as well. Okay. Now, Who's considered to be a self-pay patient? Well, it's a patient with no insurance at all, which we don't see that often anymore. And you might be thinking, well, yes, I do. No, they have insurance. It's just their insurance doesn't cover chiropractic, or there's a $10,000 deductible, okay? Or there are items or services or codes that are not covered by their health insurance, or patients, hear this, who elect not to use their insurance. You see, this is why a cash practice is affected by this law here, okay? All right, so in this case here, keep in mind that if a patient comes to you and they do not have insurance benefits, maybe as an example, you are not in network with their insurance company, and since you are not in network with their insurance company, the patient now has no benefits, okay? So therefore, what you want to do is when a patient calls, you're going to say, do you have insurance that you are planning to file? Now, remember, you cannot opt out of Medicare, okay? You could be a par or a non-par doctor in Medicare, but you still have to file a claim for Medicare. But when a patient, when a patient has to pay, one of the most deterred questions is when the patient says, how much does it cost? Doctors want to give everything away for free, right, staff? It's like, because we have kind heart and we want to help the patient, okay? But the way that you answer that is according to your insurance carrier. Everyone listen, we are not responsible for the insurance the patient has, or maybe the insurance they don't have, you see? And so you'll just say, according to your insurance carrier, since our office is not in network with your insurance, you do not have any benefits. So therefore, when you are talking to a patient, do they have insurance coverage? Yes or no? Are there benefits for chiropractic available, and do they wish to use their insurance? Okay. Now, if any of those questions are no, then as I said here on the telephone, give verbal notification of the fee or the ranges of fee, such as an exam. The doctor doesn't always know what they're going to do, but typically they're going to do an exam the first day. Okay. All right. Okay. Let's move on. I know, Medicare. What's the fee schedule for Medicare? Okay. And this is what Christy was alluding, they just released it last night. Okay. Last night, January 9th, they released it. Okay. Now, most carriers, and I was on the computer starting at 7:00 my time, looking, and most carriers have not updated it here, but take a picture, take a screenshot, whatever you need to. Okay, cms.gov/Medicare/physician fee schedule/search, and you go in there. You're going to get this right here, and you go in there and you fill it out for your locality, which is like Illinois or whatever state here. Okay, and you'll look up the fees. All right, there are multiple states. Okay, there are over 200 of you on this call right now. I can't go through every state here, okay? But if you go on here, you can look it up, all right? I also will be posting fee schedules as they're available. I already know for Illinois, I already know for several states here what the par amount and the limiting charge will be. As that becomes clearer for every carrier, I will let you know, but you can look it up right there on your own, okay? All right, now, there are different carriers. They call them MAC, which is the Medicare Administrative Carrier. I'm giving you a list here. What state are you in? And so if you look here, here's several states. Look up your state. And if you don't see it, there's another slide. Okay, so look up your state. And on the left side, you'll see like as an example here, Mississippi. Okay, you are in Novitas Solutions, your jurisdiction H. Okay, here's some others here. And NGS, Novitas, whatever it might be, Palmetto for North Carolina, and of course Florida, you're at First Coast Service Options there. Okay, so now look up your and again here, look up your jurisdiction and your carrier left and right for your state. Here's another one. Okay, so now go into your carrier, and this is not updated as of this moment, but it will be within the next few days here, where it'll be on your carrier site. Now I'm going to go back here again. Okay, and there, right there, this is current right now. You can look it up. There is a fee schedule on your carrier site, but it's wrong. This is the right fee schedule here. Look it up for your state. Okay. All right. When you go in there, you're going to see different localities. This happens to be for New York. I just use it as an example because I recently taught there. So if you are in Manhattan, you're in locality or zone 1 of NGS. Okay. So you should know what zone you are in. When you look it up, you keep in mind there, you see where it says on the left side there, that hashtag, that is not for your office. And so what I did here is I told you you're going to be looking at these bars here for 98940 for 142, and then you'll see the par amount, non-par, and the limiting charge. For you non-par doctors, you cannot put your normal fee on the claim form. You have to put the limiting charge. Okay, par doctors, you can put your normal fee or the fee that is present. Don't look at the amounts here. Okay, look at what is on that site that I gave you. Okay, the reimbursement for Medicare did go down in 2023. In most instances, it went down about 50 cents. I know, and I know, okay? I am just a messenger. Do not shoot me, okay? But the key is the deductible went down too, so patients don't have to pay as much out of pocket. And, that's why you want to make sure that you keep up to date. And the deductible, I'm drawing a blank, but I believe it's $226. Okay. All right. Okay. Now let's move on to the E&M guidelines here. Where time is flying by here. Okay. The E&M guidelines changed in 2021 and they changed again in 2023. I do have a manual on it that you'll see on my website. You can get all the manuals and use that bundle it promo code, and you'll get a great deal plus free shipping. Okay. The bottom line is that the level of code that you use is based on either medical decision or time. And I'm telling you, my opinion, do not use time, because time can be audited. Medical decision making is objective. In other words, how many problems are you treating? It's not neck and back. It's neck, mid back, lower back, SI joint, maybe shoulder joint. Okay. What data did you review? Did you order? Did you analyze? Did you look at x-rays? Did you analyze those x-rays? Did you do an examination? Did you do a foot leveler's kiosk, the scanner on a patient? All that is data. The risk is typically low. All right. Now, when you look at the medical decision making, as I said, it's the number and complexity of the problems that you're treating, and you write that, you document it down, and then the data that you reviewed and analyzed. Don't just say x-ray reports were obtained. No, what did the x-ray report tell you? And you document that as well. All right. Here's some tables, just the same 3 columns here. And look at the columns here. number and complexity of the problems, amount of the data to be reviewed and analyzed, and the risk. And remember, 2 out of the 3, and so whatever the common denominator is. Okay, now just hear me out. If you're charging a level 2 exam, a 99202 or a 212, it says that the patient has one self-limiting problem, there were no examination, no x-rays taken, and risk is basically none. Is that your typical patient? No. Okay. In my opinion, chiropractors in most instances will never be charging a level 2 exam. A level 3, that's our bread and butter, right? 2 or more self-limiting problems, neck and back pain. Okay. You're looking at, review of external notes from the providers, other providers here, ordering of tests, and then analyzing the results of the tests here. That is considered to be low medical decision making. Now, when you're looking at the amount of data, you're going to write down everything that you looked at and everything that you considered in your report. When you look at a level 4 exam, now you have 1 or more chronic problems with an exacerbation. Think of a hot disc. Think of an auto accident, maybe with even post-concussion syndrome, okay? 2 or more stable chronic illnesses or an undiagnosed new problem with an uncertain prognosis, or systemic symptoms like bowel and bladder function changes, inability to walk properly, things like that. So those kind of patients, we see that. And when was the last time you charged a level 4 exam? Yeah. Okay. And so the key is, that's why you want to be aware of this as well. Now, what's the change for 2023? More emphasis is being placed on medical decision making, your thought process, and they cannot audit your brain. Okay. All right. Now, I know this hour is going by so quickly here. Okay. And the last thing is your diagnosis. Think about it here. This patient comes in and has a real serious problem. You are spending time in consultation. You're spending time and brain power, which is your medical decision making, to examine the patient, analyze what you found, and come up with a diagnosis. And you say, oh my gosh, this patient needs to come in 3 times a week for the next 4 weeks. And what's wrong with the patient? They have cervicalgia. Do you understand that cervicalgia means you have neck pain? Now, I would never, ever go into a report of findings and tell a patient, after studying talking with you and studying your x-rays and your examination, you have neck pain. And even worse than that is muscle spasms, contracture of muscle. Come on, right? What does this patient have? What do you know? And it could be a sprain and strain. Sprain will support manipulation. A strain will support soft tissue work. Well, they didn't actually do anything that, lifting up or, burying a dead body or something, right? Okay. No, but what about a cumulative sprain like lower cross syndrome or upper cross syndrome? So the key is use your brain power, your medical decision making, and tell me a specific diagnosis here. Your diagnosis is your first line of communication on the claim form, and look to see what you're writing here. I see so many of these doctors here getting audited, and I look there, cervicalgia is the diagnosis, or muscle spasms. Come on, that's not a diagnosis, that's a symptom. When you look at some of the rules here, okay, I always say code what you know. Codes that describe symptoms and signs are only acceptable if that's the highest level of diagnostic certainty documented by the doctor. Okay, and so therefore, that's all I know is that you have neck pain. Maybe that's the possibility, but it's not all the time. Okay. Now, if a patient has an auto accident and they have a sprain and a strain, would you expect them to have neck pain? Yes or no? Yes. Would you expect them to have spasms? Yes or no? So under that umbrella of a sprain strain, as an example, signs and symptoms that are associated routinely with a condition should not be assigned as additional codes. In other words, if you have something like a sprain strain or sciatica, you don't tell me that they have contracture of muscles, you see? And so that diagnosis should be out as well. And does the patient have complicating factors? Maybe they have sciatica complicated by degenerative disc disease, but for DDD, you need an x-ray report, right? And so now the complicating factors always go last, all right? So whatever, and then the last bullet there, whatever is worse goes first. All right. So the key is, here's some changes here. They got rid of lumbago back in 2022 here, and they replaced it with low back pain unspecified. Is that a good diagnosis? No. Vertebrogenic lower back pain is an end plate deformity, and it requires an MRI. That's not my opinion. That's what the guidelines say. Okay. And so just like cervicogenic cephalgia, cervicogenic means it actually originates from the neck. So therefore, give the neck diagnosis first, and then you give the cervicogenic cephalgia, which is a great code, by the way, G44.86. All right. But then they actually increased it even more for 2023. And keep in mind, these went into effect October 1st, 2022, which is the fiscal year 2023. And so there are disc displacements, okay? Disc displacement, you have to have an MRI or a CT for. Disc degeneration, X-ray, MRI, or CT. Okay, and here's some other codes there. I know this is fairly quick. It's going to be archived here, and there are books available, askmario.com, okay? Okay, here's one that is a new code that you should be aware of, which is a torn annulus of the disc. It's not herniated, but it's torn. So it's called an annulus fibrosis defect. And so whether it's small or large here, that's all covered in the book here. But basically, it depends on the size of the defect, which they usually talk about in an MRI. All right. How many of you out there do rehabilitation? Okay. Well, keep in mind that concussion, those codes also changed here. And on the right side of your screen there are the new concussion codes. So you should be aware of that as well. Now, lastly, when you put those codes in order, if you have a neurologic code, always put that first. Then comes structural, if you have it. Functional. Functional is for rehab. Okay, soft tissue. Why do you do trigger point therapy? For trigger points, right? Which is myofasciitis or fibromyalgia, and then complicating factors always go last, okay? Here's an example of some deconditioning code. This is just an excerpt, all right? And so now, if you have weakness of a muscle, deconditioning, that allows you or supports rehabilitation. Okay, lumbalgia does not support rehabilitation. All right, but what if that muscle weakness is just in the atrophy of the thoracic region? Now they have new codes, M62.5A1 as an example. So you should be aware of these codes here. All right. All right. Now the last thing, and this is more prevalent in 2023, are the social determinants of health. At the bottom of your screen there, SDOH. Social determinants of health are not payable, but they explain why it's taking longer for the patient to heal. Here's an example, okay? And if you can see there, okay, on the left side here, it says change of job, or there's a threat of job loss. Okay, on the right side, you might see problems relating to release from prison. Yeah, maybe that's why they didn't come in for their appointment. Okay, Wouldn't it be nice? And let's just talk, just among ourselves here, right? Wouldn't it be nice if we could somehow code that the patient is non-compliant with their care, right? I give them a recommendation for twice a week for the next 4 weeks, and they didn't come in, right? But they blame it on us, right? Guess what? There is a code now, okay? And I put this in here. Patients are not always broke, but the Z91.190 is patient noncompliance with other medical treatment due to financial hardship. These always go last, okay? And then patient noncompliance with other medical treatment and regimen, Z91.19. I love that code. Why? Tell the insurance company this patient is not compliant. And so there's a whole list. There's about 150 of these. Morbid obesity, there's all kind of Z codes there. And, those are in my book, okay? So hopefully I've tried to help you here. We do have other resources. Of course, this webinar, you can watch over and over and over and over and over again, okay? Use the QR code here or go to my website and you can get all of these here. If you buy any of our packs of books here, use the Bundle It promo code and you get a deep discount plus free shipping, okay? Lastly, if you do have questions, and I know there's going to be questions here, okay, number one, talk to the people at ChiroHealthUSA.com. Okay, it works. They are legit. They are ethical. They are legal, okay? AskMario.com. My email is doc@askmario.com. And I thank you for your time. Christy, I'm going to turn it over to you here and let you take it from here, okay? Thank you.